in shape there. So you ready?
Yeah.
Start injecting the Kybella, and I usually put numbing in my Kybella injections, means lidocaine inside of it, or xylocaine. You go to the dentist, it doesn't hurt that bad. Are you doing okay?
Yeah, I'm good.
And we're putting it into the level of the fat, and again, immediately the product, the Kybella, which is deoxycholate, which is a surfactant, it blows up the fat cells, and our body basically digests the fat and extrudes it throughout the body. And again, we are injecting all of the areas where she has more of that stubborn fat, very difficult to get rid of even with great diet and great exercise. And the Kybella does permanently kill the fat cells. Those particular fat cells that are killed off, they won't come back. And unlike lipo, it's much more smooth. You're not going to get the indenting effect. Sometimes when lipo is done, you get areas where indented or linear indentations that could happen. This is very smooth as long as it is placed correctly underneath the skin. You doing okay?
I am.
Very good patient. Great. And again, you can get bruised up for about 7 to 10 days, and you get swelling for 5 to 7 days. And relatively compared to lipo, there's no downtime, there's no chance of, except for bruising, complications like seroma, which could cause loosening of the skin. This actually tightens up the skin. We want to get it all the way up into all the stubborn areas up to here. We know we've had patients who, when we do the Kybella in the stomach area, they're six packs. They didn't know they had six packs, come and expose themselves. But it takes time for that whole process to happen. Kybella is not overnight. It takes 2, 3, sometimes up to 5 months to show its full effect. Usually we do 2 sections, 3 or 4 weeks apart from one another. And this is a great time to do it. We make you tell patients bikini ready. Okay, now we're going to move on into the sides. And what's very important is when we're doing the sides, when we bring this in, we get rid of the fat, the buttock looks better too because it creates that whole shelving effect. So when we get into that whole area to reduce the fat, cause that more shelving effect, the buttock's going to look more protuberant from the top, it's going to look way better. You okay?
Yeah.
A little more sensitive. Now, the side fat over here is referred to as more fibrous fat, and sometimes even more difficult for lipo to get rid of it because it's embedded within fibrous tissue. Kybella works great in this area, much better than lipo would to get rid of the fat, and it will tighten up the skin and retract the skin here. And what I find is when we do the Kybella, we do multiple areas, when the fat is gone, the metabolism of the patient improves, and they actually sometimes lose weight after 2 or 3 sessions. Some patients lose between 5, 10, some patients lost 15 pounds overall. Okay, we're done with the Kybella. It was not too bad, right?
No, thank you.
Of course.